Alright, what's up everybody? My name is David. I'm in a group with Lexi and Emma. So today I'm going to talk about tetanus. So first of all, what is tetanus? Tetanus is a bacterial infection which affects your nervous system, which causing muscle throughout the body to tighten up or cramp. There's another name for tetanus is the name that it's known for. It's lockjaw. It often causes a person's neck and jaw muscles to lock and making it harder to open the mouth or swallowing, and often causes disease, often causes a trouble in your respiratory system, which make it harder to breathe. And there are actually three clinical forms for tetanus. There's generalized tetanus, localized tetanus, cephalic tetanus. Generalized tetanus, which happen in about 80% of all cases. It's the most common form, and the symptoms include muscle spasm and stuff like that. Localized tetanus, which is the unusual form of tetanus that happens in the confined area with right next to the site of the injury. It usually happens to people with partial immunity, and also the symptoms are usually mild. Cephalic tetanus is the rarest type of tetanus. It usually associates with the lesion of the head and face. And the difference from cephalic tetanus to localized tetanus and generalized tetanus is that they causing facet cranial nerve pulses instead of muscle spasm. So symptoms and assessments for tetanus include jaw cramping, lockjaw, certain voluntary muscle tightening, which is like muscle spasm, painful muscle stiffness all over the body, trouble swallowing, jerking or staring, which is like seizure, headache, fever and sweating, changes in blood pressure and heart rate. The complications can lead to uncontrolled tightening of vocal cord, broken bones, blockage of lung artery, and also in some severe cases death can happen. So causes for this disease, it's caused from a bacterial infection, from the bacteria that are called Clostridium tetani, which produces toxin cause painful muscle contraction. And the toxins actually travels around the body through bloodstream and lymphatic system, and affects the central nervous system, block inhibitor impulses. And the spores can get into bodies through wounds contaminated with dirt or feces, wound caused by an object puncturing the skin, burns, crush injury, injury with dead tissue, and incubation for tetanus is usually from 3 to 21 days. Diagnosis for tetanus. So doctors or physicians can usually do physical examination, and by physical examination, that's usually the only way of spotting the symptom or spotting the disease. And the common first sign of older children and adults is abdominal rigidity. Sometimes medical and immunization history are required too, because they would need to use that to rule out other disease that have the same symptom in order to track down if it's tetanus or not. Laboratory tests generally aren't helpful with tetanus diagnosis because due to the incubation period can go up to 21 days, which means that the wound will be healed by then, and they can't do a wound culture at the end of the incubation period because there's no one. And history of injury means that history of injury or apparent portal can be lacking. And age is another crucial factor or a crucial thing for diagnosis, because people that are over age of 65 often has like fatality rates are usually high. So risk groups for people that are normally diagnosed with tetanus. So people that have never received tetanus vaccine, people that are diabetic, people that have history of immunosuppression, and people that are abusing different kinds of drugs. So treatment for tetanus. So tetanus can be life-threatening without treatment, which has about 10% to 20% fatality rate. Wound care is very important because you want to clean the infection site. As soon as you spot that you have a injury, You can do that by removing dirt, dead skins, foreign objects. Doctors can also prescribe you antitoxins. That's usually at the beginning stage of this disease, because it only affectable when toxins hasn't yet bind to nerve tissue. And they can always give out TIG, which means tetanus immune globulin, and they give them out by 250 IU intramuscularly. And if TIG is unavailable, clinicians can use immune globulin intravenous. Sedatives can be used when there are severe muscle spasm or severe seizure presenting. Antibiotics are used to fight bacteria or fight the bacteria that cause tetanus. And most importantly, vaccine. And you want to do that as soon as possible, because getting tetanus doesn't mean you have the tetanus immunity. But you have to get the immunity by getting the vaccine of this disease. And the vaccine has 4 types. There's DTaP, BT, Tdap, and TD. And it's recommended for all ages. Prognosis and follow-up. So you can do supportive therapies to stay in intensive care settings to help with severe cases. Tetanus is very easily prevented with vaccination. So as long as you stay up to date with your vaccine history and your 10-year booster shots, which is after the first dose of Tdap, and you do that every 10 years. The booster tetanus vaccine is typically given in combination with a booster of TD. And there are the sources.